It's pretty deep in there.
Yeah.
Hear all that?
Mm-hmm.
Good.
Ooh, yeah.
There they go. So go ahead and tell me, what can't they adjust?
Yeah, so
You're like, yeah, my previous chiropractor.
so I've been to a couple of chiropractors and they've never been
Okay.
able to adjust my mid back, and they said it might be because my spine is fused.
Is
Like
it fused?
I don't know. I haven't X-rayed it or anything.
So how are you diagnosed with scoliosis then? Just with the
I
forward bending
X-rayed
type?
it like forever ago, and my scoliosis is a lot better now.
Okay.
But my mid back is always giving me issues, and it's been hard to correct.
Where can you just point to where it is?
Yeah, like right here.
It's kind of like there's this flattening here where it's straight or straightening, which is probably into the neck.
Yeah.
So you're kind of, as the head goes forward, it can extend down into the mid back. So you must look down a lot. You know,
yeah, I
there's,
do.
There's a flattening here, right here in your
Okay.
back, where the head is forward and it's translating down into the mid back.
I see.
Right below that flattening, where you have a curve, there's this flattening, and then right here,
Yeah.
a spasm, and there is this curve where you actually bend out, which
Okay.
is you're supposed to have.
Okay.
Okay, but
Got it.
what you're not supposed to have is this here.
Yeah.
Most likely, it's just looking down
Okay.
that's causing
I
this.
do look down a lot.
Yeah.
In my laptop.
I don't usually see this unless it's somebody that works
Okay.
habitually looking down.
Yeah.
You're supposed to have a curve here, right? And then like a lower curve down here, lordosis
Okay.
here. And that kind of brings your head back over your pelvis and we walk upright, right?
Uh-huh.
But if you look down all day, it's coming down into the thoracic spine,
Right.
okay? And then this part is actually having to bow
I see.
back out. Okay, so this is
That
what's
makes
happening.
sense. Yeah.
So you're gonna feel like this is really spasmodic because it's having to hold you.
Yeah.
It's meant to hold you here.
Okay.
Now you're asking it
Yeah.
out there. So it's that spasm is there because your body feels the torque
I
being
see.
applied to the system.
Right. Right.
So it's not necessarily a bad thing if you want to continue to look down.
okay.
However, we don't want you to. The problem is it leads to degeneration faster than
Okay.
what it should. Okay,
That
and
makes sense.
increased neck pain, increased mid back pain. If you
Yeah.
want to get rid of that spasm, there's only one way to naturally do that would be to just stop looking down
Uh-huh.
or do a lot of like yoga or extension
Okay.
exercises to get you back,
Right,
to
right,
stretch
right.
open the structure. That's the only thing that's going to get rid of that.
Okay.
The only way to test for fusion
Uh-huh.
is to take an x-ray.
Okay.
And if you haven't had an x-ray, did they tell you your spine was fused many
No,
years ago?
they said
or-
it might be.
There's no might. It either is or it isn't. Oh, your chiropractor, that was his excuse for your spine not moving.
Yeah, maybe.
No. It's fused. No! Why would he tell that to you?
Yeah.
You never say that unless you have
Unless you know.
a confirmation, like
Right.
a verification from an x-ray. I would never tell a patient your spine is fused. That's why
Yeah.
I can't move it.
Okay. Yeah.
Especially when I feel this huge spasm there, which
Right,
is
right.
probably the cause of it, not, let's see, genetics would be a reason why I would fuse, and then injury.
Okay.
Like you got hit and
Yeah.
whacked in the back.
That hasn't happened, so.
All right, anything else?
So my neck has been bothering me for months.
Okay. Well,
I'm starting to feel like it's like a pinched nerve or something.
does it go down your arms?
No, but I feel like I'm used to, or like
Right.
maybe slightly.
And then if I push, does that pinch?
Yeah, on this side.
Okay, and then if I push.
No.
So what you could do is have imaging of your neck
Okay.
if you wanted to know exactly. So what they usually do is you go to your primary and you say, I've been having neck pain for XYZ.
Mhm.
They go and give you a consult, they take an x-ray.
Okay.
X-ray either finds something or it doesn't. Then they go and they get an MRI.
Okay.
Okay? And which is not a big deal. It's painless. It's just
Mhm.
an image. You just sit in a tube and they take an image.
Yeah, I have no clue how that might have happened.
Like
though.
if you don't, the forward head posture.
Okay.
You might
Forward.
have some discs in there that are complaining.
Okay.
Okay, and I can't feel a disc. Put your hand on your neck. Feel your neck. Feel the muscles in here. See See how the muscles kind of relax?
Mm-hmm. Yeah.
And then are pulled tight.
Right.
Okay? So the only way to get rid of that spasm is to stop asking your body to do it.
Okay.
Which is... You still have great flexibility. Even if it's just for a minute. Your neck is like... It is not used to it.
Yeah. It does pinch a little bit when I look back.
Yeah, it will.
Okay.
It will, because that disc is there. You have to kind of gently train it.
I see.
To go in. Here we go again. The disc, these are the discs, okay?
Uh-huh.
When you go forward, they creep, because of the pressure on the front, they creep backwards, and this is where they pinch.
Okay. I see.
Again, an MRI would tell you what the degeneration level is.
Okay.
I can't know.
Okay.
You could have
So I should get one then.
If you really want to know, yes.
Okay.
And your primary can do that for you.
Okay.
You're from California?
Yeah.
I have a license there if they're not willing to do one.
Okay.
Okay? Like, I can order you one.
Okay.
I know. I have a lot of people from California. I'm bi-coastal.
Uh-huh.
So, yeah, if you need one there, like, they're like, no, you don't need one, and you want one, I'll give you one.
Okay. Sounds good.
So, when you look back, do you see how that takes the pressure off of the disc?
I do.
But what does it do? It closes these holes.
I see.
So, if the disc is sitting in here, and you try to look back, it's going to still pinch. So, you
Uh-huh.
have to keep working on it and get the disc to creep back in.
Okay. So I could do that myself. By
Of
just
course.
looking up. Okay.
Not this. Your
Yeah.
chiropractor's going to tell you to do this. That jams the
Oh.
facets. Old science, new science. Look back,
Okay.
and then tuck your neck.
Okay.
They've done so many studies of this.
Interesting.
No hot water here. No hot water on the low back. That's the
Okay.
rule. You can put hot water in the thoracic spine.
Got
That's
it.
fine. You can do whatever you want there. Rib cage is usually pretty sturdy. Yeah, right in here. How hard? You tell me, okay?
It feels good.
Okay.
Yeah.
I'm cleaning that out.
Yeah. What is that?
Scar tissue. It's a buildup, like a callus on your foot.
Yeah.
It's a callus in your neck.
I see.
It's the way the neck makes calluses.
Mm.
There you go. I'm gonna kind of grab this. There you go.
Oh yeah.
I'm gonna come back to this. Don't you worry. I just got to get enough of it for the adjustment.
Mm.
I want it to just. Right here. Think thoughts. That's as much as it's gonna go. So you must be getting that yourself in the morning. You're stretching it.
Yeah, probably. I do that.
Yeah. It's okay. You're really taking it this way to the right, though.
Is that bad? Okay.
I want you to take it back. If you can learn to take your neck backwards and not side to side, you're not the only one. Okay. A lot of people think they want to pop it and they go this way. You're irritating it. The joints are not meant to go side to side. They're meant to go back and forward like this.
Got it.
Side to side, they can.
Mm-hmm.
Just a little tiny pull. I don't have to pull too hard on you. I'm like, ooh, a little pull. Did you used to do dance or anything?
I did for a little bit.
Not
That's how I injured my knee, though.
okay. Like, how did that feel?
So-
Just me doing that on the
That
knee.
was fine.
Stop me at any point.
Okay.
When I press, does that hurt your chest in the front at all?
No.
Okay, because this is the kind of force that I'm going to have to be doing.
Okay.
Now, I have a couple of moves up my sleeve.
Mm-hmm.
I do my favorites first, and then I progress to the more advanced ones, okay?
Okay.
So take a deep breath in. I'm going to push. Here's the adjustment. Let's see how it moves. Yeah, and it is tight. How did that feel in the front of your chest?
It felt fine. Yeah.
Okay. Take a deep breath in. Sorry.
That's good.
I went deep on that one.
Yeah. Did it move or?
I don't think so. It's pretty.
Tight.
Yeah, it's okay though. You know, I'm doing this cold, no warm up.
Yeah.
If that makes sense. Deep breath in. A little bit. See that?
Yeah.
I don't think they're fused. I feel your ribs moving.
Okay.
Okay, your ribs are moving. And you have springiness.
Mm-hmm.
You understand see how it's springy?
Yeah.
You're like, ow!
No, it doesn't hurt. It's just like awkward to talk.
Oh, while I'm squeezing the air out of you.
Yeah.
Yeah, no, it's springy. Usually with fused spines, they have no give.
Mm.
And then there's the other thing is that you might not be a poppy clicky person.
Yeah.
You know?
I feel like I am, but for some reason in that one area.
See, this one did move,
Mm-hmm.
and it didn't really give an audible.
Mm-hmm.
Oh, see there it moves again. You understand? It is moving.
Mm.
It's just taking some persuasion. You know, I'm kind of sitting here and milking it, they call it.
Mm-hmm.
I'm sitting here and like,
Mm-hmm.
you know, and it's kind of sliding. There you go.
Mm.
Did you feel that?
Mm-hmm.
Well, there you go. I think what it is you hold on to it.
Oh, okay.
And I'm having to kind
is this
of
subconscious or
yes, okay. It's okay. You should see how I am as a patient. I'm a very poppy clicky person, but I will hold on for dear life. They have to work for every crunch. You can ask Dr. Max, he knows. He's like, "Oh, Brenda." I'm like, I'm trying.
Yeah.
I'm a very like
I'm trying to relax.
yeah, it's just really hard. But it just went. You understand? I'm just having to kind of, there goes again. That's as much as you go.
Mm-hmm.
Your joints are that's how they're made.
Okay.
There they go again. You just need time. Okay? You need somebody to have patience with you, okay?
Yeah.
That's all this is. I'm talking to you, right? I tell jokes, try to make something funny, and then you forget that I'm pushing on you. Because when I say, here it comes, you know, it's a little intimidating.
Yeah.
Okay. I think you're fine.
Okay. Does it feel stuck? Like back?
No,
Okay.
no. Good.
Yeah.
See, there's no scar tissue here.
Mm.
Feels great. Feels awesome.
Yay.
Same thing, I'm checking. A little bit here. Not bad. There we go. I'm going to count back from 5. If it's too much, I'll stop.
Okay.
5, 4, 3, 2, there it goes. 1. Done.
That felt good.
Your tissues aren't too inflamed. There's some more scar tissue coming out. Feels great.
Mm-hmm.
Feel that? That's a lot of scar. That's in the surface. Feel the bubbles? Like they're kind of like, let me pull this up. Let me pull this up a little bit. They're like, feel that?
Mm-hmm.
Now that was your bone. Ooh. Wow. Cool.
Mini pops.
Mm-hmm. So I don't think you're not hard to adjust at all. Okay, nobody should be putting that much force into you.
Mm.
All right, it should be very light. There's no way I can power my way through any of this.
Mm-hmm.
Here we go. Good. Pulling at the skin, seeing if I can't break some of those adhesions up. Good. Okay.
This is for muscle.
You'll feel it. It's the fascia.
Oh.
You have a bunch of little blebs in there
Uh-huh.
and a couple different regions. So tuck your chin for me. I'm going to put some oil here as well.
Interesting.
My best bet is to kind of comb this through. And yes, you are bruising right here, okay?
Okay.
Right where we felt all those little crunchies.
Feels good.
Yeah, get them out.
Yeah.
You always bruise the most the first time, okay?
Okay.
But a massage therapist can do this for you as well,
Mm.
okay?
So this is for
Can you fascia?
fascia.
Pulling the fascia, yeah. Mm-hmm. So I'm smoothing this out.
Mm-hmm.
Okay. Oh, my goodness. Hear all that? Combing it out. You are going to need this done a couple more times if you want to get rid of that crunchiness.
Okay.
It's pretty deep in there.
Yeah.
Hear all that?
Mm-hmm. Yeah.
You can soften this up though.
Mm.
And you are bruised. Hopefully they don't say anything at TSA. You just say Dr. Mondrag and they go, oh, okay.
Yeah.
I know her.
Are you okay?
No, just tell them it's therapy.
Yeah. Yeah, wear a sweater.
Yeah, I don't think they see that on the x-ray.
Mm-hmm.
All right, come on up. I'll show you your Shaw marks.
Okay.
Actually, just go from there and let's go on your side.
On
I
my
changed my
side.
mind. You're already here.
Okay.
Yeah. You're going to be on your side like this. Very good. And then lean. I got you. Head back. Look back. Yes. Yeah, you pop. Other side.
That was amazing.
I don't think I can crack. Look up. Yeah. Very good. I'm just seeing if there's anything left. No, there's not. All right. On your face down again.
Okay.
Is it too much?
Mm-mm.
So just take a deep breath in. It's right here. All the way out. Good. That's all it is. On your back. I'm going to check it. Does that feel okay?
Yeah.
That's all that is. No. Very, very nice.
Okay.
Come on and sit up and face that way. I feel that bone to click.
Yeah, it actually feels a lot better. Yeah.
Chest out as much as you can. Elbow back. I have to fight for each one. For each one. It's okay. Chest out, look up for me. And then elbow back. Push.
Oh, it felt good.
You make me work for it. It's okay. It's okay. It's my job. I shouldn't complain. That's what you're paying me for.
I'm relaxing.
It's okay. It's okay. Now the trick is if I could do it again now that you know what's coming.
Yeah.
So I did it on this
felt
one
really
first.
good, though.
Yeah. If you can relax that, good. And then elbow back. More. But relax. Yeah. Now push. That's it. That's all it goes. It went.
Yeah, I heard it.
A little bit of crepitus in that elbow.
Okay, what's that?
Like crunchy, like joint
Oh,
knives.
yeah.
You okay?
Yeah.
Okay. Just another thing that I'm observing.
Mm-hmm.
See, this elbow is clean. And then we
Yeah,
go to
this
this.
is like hyperextended too. I don't know if it has to do with it.
Not much. Feel that? It's loose. There's some
Interesting.
joint laxity
Okay.
in this elbow.
Where does
Just
that come from?
I don't know.
Okay.
I don't know. But just be careful with this elbow.
Okay.
Just know that it's very loose.
Okay.
Yoga is really good
Okay.
to help with those. Just,
Yeah.
you need to be stretching,
Okay.
taking the joints through the full range of motion.
Got it.
Let me show you your back.
Oh wow, yeah. It's definitely. So what
Yeah.
is that?
That's the Shaw.
Okay.
Goes away in 7 days.
Okay.
It'll be gone.
Got it.
Completely won't even know you had it.
Yeah.
It's just metabolic waste. It's myoglobin that's in the muscle.
Okay.
And I'm pulling it through the skin.
Got it.
You don't. It happens when there's scar tissue.
Mm-hmm.
It gets trapped, and I'm going to actually pull you up.
Okay.
If it's too much on your chest, let me know.
Got
Because I
it.
do have to extend the chest quite a bit,
Okay.
like this. I'm going to give you a test run. Is that too much?
No, that feels good.
Okay.
I heard a pop in there already.
Okay, here we go. Take a deep breath in. I'm going to gently pull you up. All the way out.
Ooh, yeah.
There they go. Got it? Okay,
Yeah.
good.
That felt good. That was loud.
I'm an expert popper, you know?
Yeah.
This is what we do.
Yeah.
Okay? So that was everything.
Okay.
Let's do the exercise. Have a seat, face that way.
Mm-hmm.
Bend your knees. And then arms out to the side, careful of the table.
Yeah.
So how are you going to get off of this thing? You're going to roll to the side. Don't do a sit-up. Yes.
Okay.
Teaching you here so you can
Amazing.
remember at home.
Yes.
Okay?
Okay.
That was head to toe. Okay? Kind of little mini version, but I think it was enough.
Yeah.
Hopefully that was enough.
Thank you so much.
Yeah. Let us
So-
know how you're doing.
Okay. Okay, yeah, we'll do.
Okay.
Yeah.
All
sounds
right.
good. Thank you so much.
All right, and good luck on your journey, and be safe, and
Yeah.